Well, good evening, everybody. My name is Susan Van Epps, and I'm the Division Manager for Programming at Loudoun County Public Library. Thank you for joining us for tonight's program, a live update on COVID with Loudoun County Health Director, Dr. David Goodfriend. Dr. Goodfriend, thank you so very much for your time. We know you are incredibly busy right now, and we really appreciate your time with us tonight.
Well, thank you for inviting me. I'm happy to be with you all this evening.
Thank you. Just to let everybody know, we are going to have questions for Dr. Goodfriend that we're going to ask him, but while we are doing that, we are also going to be taking questions live from you in the chat box. I'll be monitoring those in the background, and we'll get to as many of those questions as we can. I'll put a question in the chat box in just a second so you can see where it is on your screen. Now, before we get started, just two quick things. I would like to first recognize and thank the team from HIS LLC who are providing sign language for us tonight for tonight's program. And now I'd like to introduce my colleague, Lorraine Maffa. She is the program coordinator for adult programs at the library, and she'll be conducting tonight's interview with Dr. Goodfriend. Welcome, Lorraine.
Thank you, Susan. And thank you, Dr. Goodfriend, for taking our questions tonight. I'm going to jump right in and get started. What percentage of Loudoun County is currently vaccinated, and what are some of the factors that are making Loudoun faster or slower to vaccinate than other Virginia counties?
So in general, we're on par with all the other counties. I think about 12% or so of the county has been vaccinated. We receive vaccine in two different ways. Originally, we received vaccine to give to our 1A priority group, which were healthcare providers and those in long-term care facilities. And subsequent to that, we've been receiving it on a per capita basis for those in high-risk groups, such as the people over age 65, law enforcement, those 16 to 64 with underlying medical conditions, and other high-risk groups like child care providers and teachers. So we're about at the same level for folks who've been vaccinated as our counterparts.
Okay, thank you. With the new Virginia list, will Loudoun residents be able to obtain a vaccination in another location or only in Loudoun? And can residents of other counties continue to come to Loudoun?
Well, what we ask is that people get vaccinated where they live. Now, for some people, or previously, they were signed up through their employer. So it could be where you lived, you worked. But particularly now with the new state system, each locality will pull out their pre-registered folks from that system. So people will go in general to where they live. Now, there are other ways also to get vaccine. As some may know, CVS does vaccinations. That's not affiliated with the state program. So that's just to sign up. And so we encourage folks, in addition to signing up with us, which is now on the state system, vaccinate.virginia.gov, or if they previously signed up with us in Loudoun County, we will get to you very soon. But in addition to that, places like CVS, go to their website, and if you see a place open, whether it's in Loudoun or someplace else, you're welcome to sign up.
So that raises a question. Does the allotment of vaccines going to CVS, Walgreens, and other pharmacies affect the health department's allotment? And if so, to what consequence?
Okay. They do not. Those come directly from the federal government. Now, definitely, if there was not a federal pharmacy program, we would be getting more at the state level. But that doesn't come from Virginia's allocation of vaccine. It's a separate cache of vaccine that the federal government is using with various pharmacies throughout the country.
Okay. How does the Loudoun Health Department handle no-shows at vaccination events? And how does this differ with pharmacies? Is there an opportunity for a wait line?
And actually, there is a wait line. And the way we do it is we have the next set of folks who are in our waiting list. We contact them ahead of time and say, if there's an opening, or if at the end of the day, one of the vials is not fully used, could we give you a call and have you come down to get vaccine a day early or a week early so that we don't waste anything? We're not able to open that up to the general public because we just don't think that's fair to the people who've been waiting for so long.
Okay. At what capacity are our hospitals, and why do you think the number of deaths are decreasing in people hospitalized?
So our hospitals are doing great. What we found out is the mitigation steps that people have been taking, while they're not perfect for COVID, they do terrific for the flu and for the cold. So we really have not had a flu season this year. And that was our concern going into the winter, that we'd have the second phase of COVID, which we did have around the New Year's and Christmas holidays, at the same time that our hospitals are usually busy with pneumonia, flu, and other respiratory illnesses. So there are plenty of hospital beds. The emergency rooms have plenty of room. Our doctors' offices have plenty of capacity to see people safely. So there's not a reason to put off going to visit. Now, we did have a number of deaths over the holiday season. A lot of those are being recorded now. So we've probably had about 60 deaths that have been recorded in the last 2 weeks that are from the Christmas, New Year's timeframe. In general, though, our hospitals have learned so much over the last year of how to treat people with coronavirus, that the fact that if you get coronavirus, if you get sick enough to be hospitalized, the likelihood that you'll be able to get out of the hospital is much greater now than it was over the summer.
Oh, that's encouraging to hear. Do you think an updated variation of the vaccine that addresses the variants will be available soon? Will a booster be required for people who were vaccinated earlier?
It's hard to know what the future will be like, because as of now, we've had over 85 million shots given in the United States. I think over 50 million people have received at least one dose of vaccine. We don't know how long that immunity will be good for, and we don't know in terms of new variants or new mutations of the virus that come along, whether that will impact it. A likely scenario is that COVID will be like the flu, that you may need to get an annual shot in order to keep your immunity.
What about with the Johnson & Johnson vaccine? So that only one is required for that. Do we think at a later date, you're definitely going to need a booster for that one?
We don't know. So Johnson & Johnson is made very differently than Moderna and Pfizer. We're getting our first shipment of Johnson this week. We're going to be having at our Dulles Town Center the ability to provide Johnson & Johnson for the first time on Saturday. So we're looking forward to learning how to do that, as well as we're doing Pfizer and Moderna and seeing what the side effects are. Right now, it's not looking like you're more likely to need a booster for Johnson & Johnson than for the other two. But as time goes on and more people get the Johnson & Johnson vaccine, we'll see. So if it turns out in the summer that there's more breakthrough infections in one brand than another, then there may be a need for a booster shot.
And are you informed at the time you get a vaccination which shot you're getting?
Oh, you definitely are informed at the time of vaccination. So when you go to our clinic each day, we'll have Moderna vaccine and Pfizer vaccine. You're told at the time which one you're getting. You get a card which has a sticker on it that says the product and the lot number, the expiration date, and the date that you received the vaccine. Because Johnson & Johnson is a very different type of vaccine, what we're likely going to be doing is having dedicated days either for Johnson & Johnson or Moderna Pfizer, because we have been hearing from folks preferences of one versus another. Some may just want a one-dose vaccination. Some may prefer a two-dose, or some may just prefer a vaccine that's been out longer. And we want to give people that option. So when folks sign up, it'll either be saying, going into the future, Moderna Pfizer, or we'll be saying Johnson & Johnson. Right now, other than our Saturday clinic, though, we don't know when we'll be getting more Johnson & Johnson vaccine. So our recommendation to folks is if you've had contact from us, or you're on a list with CVS or some other entity to get your vaccine, don't hold off to wait for Johnson & Johnson, because the last thing we want is for someone to get infected with COVID because they put off getting vaccinated.
So you've said a number of times that the Johnson & Johnson vaccine is different. Can you explain that a little bit? What do you mean by different?
It's made in a different way. So the Pfizer and Moderna vaccines are with a newer technology called mRNA, but they're made in both very similarly. So while there's slight differences between them in how they work, they're fairly interchangeable. They both need the booster shot at different days, but those are very slight differences. Johnson & Johnson is based on a very different approach with an adenovirus. That's been used in other vaccines. It's an older technology. And it, again, has some advantages to it. But it's just not comparable to the others. So that's why we're treating Moderna and Pfizer as essentially interchangeable for first doses. Well, you still need to get the same product for your second dose that you get for your first. But Johnson & Johnson is being a very different one because, again, we really don't hear many people having a preference between Pfizer and Moderna, but definitely folks are developing preferences between Johnson & Johnson and Moderna Pfizer.
So apparently the Johnson & Johnson vaccine has a 60% effective rate, but their rate is much higher when it comes to getting seriously ill. Is that correct?
Right. So the endpoints for all of these vaccines in their studies were people getting sick. And they're all very good at preventing people from getting seriously ill, because that's what we really want. We want to stop people getting hospitalized, people dying. We also don't want anyone getting infected, because if you get infected, you could pass it on and you don't get herd immunity. So what we're learning now more and more, particularly with Moderna Pfizer, because it's been out for several months, is how well it works to actually prevent someone from getting infected. And it's looking like that's the case. So for example, if you're fully vaccinated and you come in close contact with someone who's infectious, you no longer need to quarantine for 90 days after your second dose, because they have enough information that the likelihood that you'll get infected from coming in contact with coronavirus is very, very low. And I think as we go forward, we'll learn more, and hopefully that'll change the CDC guidance for folks as well, because we know not only do folks not want to get sick, but they don't want to pass an infection on to other people.
Right. Oh yeah, that would be huge. Okay, President Biden said that by the end of May, there will be enough vaccinations available for every adult in the United States. Do you think it's safe to say that everyone in Loudoun will be vaccinated by early summer?
We think by summer, everyone will have the opportunity to get vaccinated. And what we're looking forward to is the time where we're really trying to convince people, get vaccinated, it's good for you, it's good for your family, as opposed to where we are now, where we have folks who are high risk and have been waiting for a long time. What we don't know, though, is when or if there'll be approval for the vaccine to be given to younger folks, because that easily changes that universe of people who can get vaccinated. And we know, particularly in Loudoun County, we have a lot of kids in the county that comprise a significant portion of our population. So it may take a while longer in Loudoun County if what we hope happens is in the spring, Moderna gets approved for younger kids, maybe 13 and older. And the goal would eventually be like the flu vaccine, where anyone 6 months or older can get vaccinated. But again, when you add that many more folks into the mix, then easily that many are not going to be able to get vaccinated by the summer. Additionally, with 2-dose vaccines, it's a month apart. So even if someone is eligible to get their first dose in the summer, it's another month until they can get fully vaccinated.
Right. Dr. Goodfriend, what do you say to somebody who's afraid to get the vaccination?
But it depends why they're afraid. But if the concern was that there may be something different, maybe something unsafe about this, what's critical is that from a research standpoint, they did all the research that is always done on vaccine. Typically, what's not done in this compared to other vaccines is to study people out for years just to see how long it's effective, whether there are any long-term side effects. We don't have that answer because we don't want to wait years to start giving vaccine to people. But we know that millions and millions of people, not only in the United States, but throughout the world, have been vaccinated. So when we look at short-term side effects, they really are not any different than what we'll see with most other vaccines. That, so if people have had the flu shot, we know that you'll get soreness at the site on your arm. A lot of folks will get flu-like symptoms, and we see that at times with coronavirus. There have been some folks that have had anaphylactic, more severe allergic reactions, but it's rare. Again, the same thing when we had H1N1. What really is heartbreaking is when we have a vaccine that so far we believe is safe and effective, it's been used on millions and millions of folks. And if folks choose not to do it for fear of something new or for fear of misinformation they're picking up, and then they get COVID and something bad happens. We just learned today in Virginia that someone under the age of 10 died of COVID.
Oh.
So while it's very unlikely for people that age, that it does happen. So even if you're not in a high risk group, it's important to get vaccinated when that vaccine becomes available, because you could be one of those rare folks that has a very bad reaction to it, but you could also be one of those folks who pass it on to a high risk person.
And how is the county prepared for some of those undesirable side effects?
Well, for our county vaccination site, there's a mandatory 15-minute waiting period for anyone who gets their vaccine. And in that time at our vaccination site, we're watching those folks for those 15 minutes. The nurses that are there are all trained in emergency procedures. We have emergency kits available, and we always have emergency management, the EMS folks who can respond. But it's very unusual to do. We were even recently had somebody who several times in the past had a very severe anaphylactic reaction to vaccination. And we brought that person in, vaccinated that person safely with no problems.
That's encouraging. It's reported that on one day alone, the Dulles Town Center vaccinated approximately 2,500 people, and that the process was smooth and organized. How did the county pull off the logistics for a mass vaccination?
So we've had a mass vaccination plan in place for over a decade now. Historically, though, that's been based in high schools, figuring that if we had H1N1, if we had anthrax, if we had some other mass attack and had to get medications out to folks quickly, that high schools are the best place for it. High schools are not a great place for a 6-month campaign when we're having hybrid education trying to go on at the same time, though. So in Loudoun County, since this started, we have had an all-of-county government approach to trying to figure out the answer. And so we're very fortunate with the county's general services staff, with the county's budget staff, with the county's planning staff, that they were able to come up with this answer for us in Loudoun County. So we had a different location initially because we had to get something going quickly. But for anyone who's been through the old Nordstrom's and at Dulles Town Center, it's a beautiful site. It can handle significantly more folks than we're seeing now. So it allows us to ramp up when vaccinations become more plentiful. But it really is an all-of-government approach. And for folks who go to that site, you'll see Medical Reserve Corps volunteers, and there are many of them throughout. You'll see members of Loudoun County Fire Rescue vaccinating. You'll see health department staff, and you'll see emergency management staff all working in a coordinated fashion together.
It's really remarkable when you think about that, you know, the amount of people who have come together to make us safe. Thank you all for that. And now I'm going to turn it over to attendees for some questions. Okay, hold on a second.
I sent you a couple, but I'm going to send a bunch more. We've got a bunch lined up, so I'm going to start sending them over.
Okay.
1 second.
All right. Let me see. Can you explain some more about the efficiency rates between the different vaccines?
So each of them, so Moderna and Pfizer, 2-dose vaccinations, in laboratory studies, in research studies, they're each at least 95% effective at preventing symptoms. And the Pfizer is lower, but that's a 1-dose. Now, what we don't know is how effective they are in the field. So there's efficacy, which is how does it work under ideal conditions, and effectiveness, which is how does it work in the real world. So what we'll see over time is truly how well it works in the real world as more and more people are getting vaccinated. It appears to be very effective in the real world. Now, we don't know because we had the second wave of COVID around Christmas time, and very likely it was going to come down on its own. So we were seeing about 300 cases a day around Christmas. We're seeing about 60 cases a day now. Likely, even without vaccine, that would start coming down. But we don't know how much of that additional impact is from coronavirus, as from the vaccination.
Okay. Are you still only in groups 1 through 3 for 1B? And when do you expect to start with groups 4 and beyond?
Yeah, so for folks who aren't aware, the priority groups are divided into 1A, 1B, and 1C. 1A are the healthcare workers and residents of long-term care facilities. 1B includes everyone 65 and older, everyone 16 to 64 with underlying medical problems that increase their risk of complications of coronavirus. And then it has 11 different bullets of essential services in 1B. There are an additional 8 or 10, I believe, in 1C on top of that. But those 11 bullets comprise a very significant portion of our county. The first 3 bullets are the law enforcement personnel, correctional facility folks, and a very large group in Loudoun County, child care and K through 12 education and preschool. So it takes a long time to get through those because what we're required to do by the governor is to give 50% of the vaccine we receive to the 65 and older. And we've made very significant progress with that population in Loudoun County. And then the other 50% to those first 3 bullets and those 16 to 64, and then any healthcare providers that still haven't been vaccinated. And as you can imagine, the 16 to 64 group with underlying medical conditions is a very large group, probably less in Loudoun because we're a healthier population than others, but that's very large. So before going to bullets 4 through 11, we really want to hit those in the 16 to 64 group, because again, those are the folks that if they get infected are more likely to wind up in the hospital.
Okay. If someone has several autoimmune problems, will the vaccine be effective? I have heard that people with autoimmune problems that it will not be effective.
Yeah, so it should be effective for folks. It's not contraindicated for individuals who have autoimmune issues. The CDC has really good information on that. If folks want a specific link to that information, they could email us at health@loudoun.gov. We're happy to get them that guidance from the CDC. And additionally, for anyone who has questions, feel free to email us, feel free to call us at 703-737-8300.
Okay. Sorry. What metric will the county be using to determine when to open the next group of eligibility?
It really is, how are we doing on our waiting list?
Yeah.
It's critical for us to vaccinate those at increased risk of hospitalization and death from the vaccine. The essential services list are important, but they're important because they're more likely to pick up the virus and transmit it to others, not because they're at an increased risk themselves of getting hospitalized or dying. So again, when you get past bullet 3, the group gets even larger. All of our grocery store workers, letter carriers, public transportation, continuity of government, people who work for government, et cetera. So they're important people to vaccinate because we want to keep them on the job. We don't want them transmitting infection. But the 16 to 64 with underlying medical conditions and the 65 and older are really our utmost priority right now, because it's really about saving lives and keeping people out of the hospital.
Yeah. Do you recommend taking any specific actions after vaccination to head off potential side effects, painkillers, antihistamines, etc.?
So what's important is to not take anything before you get vaccinated. Some people will say, well, this is going to make me achy. I'll take Tylenol or Motrin or something else. Please don't do that. If you do get achy afterwards, yeah, take Tylenol. You can take Motrin, but take it if you need it. You don't want to prevent the body from going through its normal process to make you immune. And that's a concern of pre-medicating, that there's a potential it may impact the effectiveness of the vaccine. There's no evidence of it, but because we're not going to find out that evidence until later on, when we find folks who did that and then the vaccine worked or didn't work, the safer answer is don't do it. And again, the large majority of folks who have problems, really the problem is their muscle hurts at the site of injection. So if you have that bit of stiffness, you work it out on your own, put some heat on it, but take Tylenol if you need to.
What about for people who take supplements, if they're taking them before they get the vaccination, vitamins or herbal remedies for other things, could that affect the effectiveness of the vaccine?
In general, the answer is no. Now, there are some medications that are not contraindicated with vaccine, but a doctor may not want you to be on that medication if you get any vaccine. So we did have somebody who likely was on a blood thinner, and the doctor said, well, we want you off the blood thinner because you may get more of a black and blue mark if you get a needle with that. So they wanted to know exactly when they were going to get vaccinated, just in case. But again, if you look at the CDC website, there's no medication contraindication. The only guidance from the CDC is you shouldn't get another vaccine either 14 days before or 14 days after these vaccines. Again,
oh, that's good to know.
There's no evidence that it causes a problem, but because they really didn't test this vaccine along with other vaccines, they just don't know. And why take that risk?
Makes sense. Okay. What is the latest regarding risk of contracting the virus from surfaces such as packages or playground equipment?
Yeah, fortunately, we've learned a lot over the last year. And when it first started, there really was a concern about surfaces and high touch areas. Now, definitely that's a risk, but we haven't seen, for all the folks who've had delivery, the food delivered, Amazon delivered over the past year, we really haven't seen people contract coronavirus from that. For things like a whole bunch of people touching the same banister or elevator button, easily that can happen. And so we do encourage people still to frequently wash their hands. But by far the way this is transmitted is person-to-person spread, people within 6 feet of each other, people not wearing masks. And that's why those mitigation steps are really so critical. And when we've looked at outbreaks over the past 6 months, particularly, the schools that had outbreaks, the workplaces that had outbreaks, they were not socially distancing. So it really is person to person makes the difference.
Okay. Would it be better to delay getting the second dose of the Pfizer vaccine beyond 21 days to allow the immune system more time to develop maximum immunity? Assume that the vaccinated person is not concerned about catching the coronavirus between doses.
No, there's not a reason to purposely delay 21 days for Pfizer, 28 days for Moderna. That said, the CDC says you can delay up to 42 days. So the ideal is to do it on day 21 or day 28 for Pfizer and Moderna respectively. But we don't want people to worry if they can't get the vaccine exactly that time. For folks who got their first dose with us, and if for whatever reason are finding they're not able to get it within the 42 days, please let us know. Contact us at that number, contact us at health@loudoun.gov. We'll work with you because we don't want anybody to go more than 42 days if there's a way that we can help them.
Okay. If we develop a fever and feel sick as a side effect of the second vaccine, should we stay home? Is there a chance we could get others sick if we have a fever?
Anytime you're feeling sick, you should stay home. So if you have a fever, you're feeling sick after a day or so after your first or second dose, stay home. If it goes away and you're feeling back to normal and you didn't have any high-risk contact, it makes you think, because just like we see every year with the flu, people get their flu shot in January. They may have been exposed to the flu right at the same time, and they actually get the flu, even though they've been vaccinated. So if you don't think you came in contact with COVID within that week of getting sick, but it's been a day or so since you got your vaccine, you're having flu-like symptoms, it goes away pretty quickly, then you don't need to quarantine once you're feeling better. But when you're sick, stay home. There's never a good reason to go out if you're feeling flu-like. If you have an achy arm, that's a different story. You feel free to go out. But if you're having respiratory symptoms, just stay home. Take Tylenol, have chicken soup, relax, because your body wants you to be doing that anyway.
Okay. I'm going to slow down a little bit for the interpreters. What date is Loudoun up to for vaccines? When might you expect a 65-year-old who registered on February 10th to receive a vaccination and a 64-year-old who registered same date with comorbidity?
So I think we're getting a bit into math now, but we're now moving pretty quickly through the dates. So January 15th was by far the busiest day for signups. We had probably about 15,000 signups that day. We're now moving pretty quickly through the dates. I believe we're up to about January 25 or 26 for those age 65 and older. And for the other groups, probably around January 24th. And that's up from, I think, the 17th a week ago. So I think we're moving through that quickly. For those who've signed up by February 12th, which is when our local pre-registration system ended and the state transitioned to a state system, my gut feeling is we'll probably get to all the 65 and olders within the next week or two. For those, again, the 16 to 64s are a much larger group, so it's going to take some time. Part of the good news, though, is we've made significant inroads with our school system. The large majority of folks who want vaccine in the public school system have already received their second dose. That allows us to move some of that vaccine to the other groups.
What are the current places in Loudoun County where outbreaks are still occurring?
It's not as much geography as facility-based. So we do see some, for example, like with sports teams, where one high school student, whether it's at a school or at a club, brings in coronavirus and others get it. We still get them in childcare facilities. Those are probably the main areas where we're seeing outbreaks. It's hard in childcare facilities to keep kids 6 feet distant. And again, we know children are less likely to have symptoms than adults. So you can do everything right with symptom screening, but if you don't have that 6 foot distancing, you just increase the likelihood of an outbreak.
How will people without access to transportation or those isolated in rural areas be reached?
Yeah, and that's what a real challenge with the mass vaccination clinic that we have now. And we've been struggling with that issue for a while. We want to be efficient with our vaccine. We don't want to waste any vaccine, and we want to get that in people's arms as quickly as possible. And so having a mass vaccination site does that very well, but it leaves out those people who have difficulties getting to a mass vaccination site. And it also leaves out those who don't have computer access to sign up, have language difficulties, have other concerns that make it less fair for them. So in addition to what we're doing at Dulles Town Center, we are working with some private providers to help address those inequities. We've provided vaccine to a couple of sites in Western Loudoun County to help vaccinate folks who may have a geographic barrier to coming in. HealthWorks, our community health center, also has vaccine, and they're able to vaccinate lower income folks. We're also working with Inova Cares, which is a site in Sterling, and predominantly serves our Spanish-speaking populations to help get vaccine out to their high-risk individuals as well. And as we go forward and identify other entities, we want to work with them too. So a key population that we've been focusing on is our population who are disabled and their caregivers. We've held some special events for them, and we have others planned. A real challenging population that we're trying to find a good answer for is the homebound population, because definitely they can't go to a location anywhere. So even if we have one in their community, that's not something they can go to. We have to bring vaccine to them. So part of what we're doing is trying to make vaccine accessible to all their caregivers, so the virus won't enter their space. The other piece is to try to see if there is an answer that can work, where we can go into their homes, vaccinate them, and not waste that vaccine. So, for example, for Moderna vaccine, there's 10 doses in a vial. Once you open it, you've got 6 hours to use all 10 doses or you have to throw it out. So it makes it difficult to go to someone's house, vaccinate them, watch them for 15 minutes, then go to the next house, go to the next house and get that all done in 6 hours. We're trying to work through those logistics because we understand, and particularly these are individuals who, if they get the virus, are much more likely to be hospitalized. So we want to make sure they're safe.
So the Johnson & Johnson vaccine might help that a little bit because it doesn't have to. Yeah,
it does, although, and the great advantage is you only have to go to that house once. A
right.
disadvantage is once you open up that file, it has to be used more quickly. So, so it is a bit of a trade-off. The other piece is, trying to find out more about the effectiveness in a high-risk group. Because if someone is homebound and medically fragile, we want to do our best to make sure they never have symptoms, because any slight reaction might be enough to put them over the top and send them to the hospital. So that is part of the mix of what makes the most sense for those individuals to get.
Yeah, it's challenging. We are an essential labor force and have a business in Loudoun County. How can we get the vaccine for our older workforce and the ones with conditions? We have individuals that registered for the vaccine at the end of January with pre-existing conditions and still have not gotten the link.
Yeah, so definitely there are folks who originally signed up as an essential worker and then said, oh, by the way, I'm 16 to 64 with a significant underlying medical condition, but I didn't put that down. So that's a concern. We want to make sure that they're not disadvantaged because they were a mail carrier and just put down mail carrier, but they also happen to be 78 years old as a mail carrier. We want to make sure they get vaccinated. For that individual, if they submit at the end of January, we just may not have gotten to them yet, because if they're 16 and 64 with an underlying condition, again, I think we're at January 24th now, so we may not have gotten to them. If folks know that they submitted it in a high-risk condition prior to January 24th but didn't hear from us, what we're finding sometimes is the emails going to the junk file or spam folder. What we had asked people is go look in there, because CDC sends out so many of these emails that some email companies will assume it's spam. So go into your spam folders, junk folders, just check for the word CDC or VAMS to see if it's in there. Because we don't want folks to miss that opportunity to get vaccinated. And if they do email us, which we encourage them to do if they signed up prior to the 24th, and they're one of those groups that we can vaccinate now, if they haven't yet checked their spam folders, that's going to be the first thing we ask them to do, because it doesn't pay to send them out another email invitation if all of them go into the spam folders.
Okay. Does Loudoun County have contract tracers? If so, approximately what percentage of Loudoun County cases are interviewed by contract tracers within 24 hours?
So we do. We have a large number of case investigators and contact tracers. When we were getting 300 cases an hour, we really had to prioritize those. For now, we're contacting every case that comes in. The time frame is there are delays between when someone gets tested and when that result comes back. And then when that result comes back and when it gets entered into the statewide database for us to see. But I would think once we're able to see it, I can't tell you exactly, but I would believe within 1 to 2 days, we'll have that first reach out to individuals to try to find out information.
Oh. What are your thoughts on the CDC's guidelines regarding schools? Specifically, can schools safely move from the current protocol of 6 feet of distance to 3 feet of distance?
But and that's a challenge. The CDC recommends 6 feet if at all practical and possible. That we know is the safe answer. Now there may be ability to do it at less than 6 feet. A challenge with that is 6 feet is the amount that we use to determine whether someone is a close contact of a case and requires quarantine. So if a school does do less than 6 feet, one, it may increase the likelihood of transmission. I can't say that for sure, but what we do know is if and when you get a case in the school and they're only 3 feet apart, it increases the likelihood that you're going to have teachers or students that wind up having to be quarantined because they spent at least 15 minutes within 6 feet of that individual.
Okay, we have about 4 or 5 more questions. How can a person who is not immunocompromised know for sure after receiving both doses of the vaccine and waited 3 weeks whether he or she has or has not developed immunity?
You don't. So there is no way to know for sure whether you've developed immunity to coronavirus from the vaccine. And that's why, even though I've gotten both of my doses, I still, if you see me, outside of my room with the door closed, you'll see me with a mask on. Because I can't tell you for sure that I'm not a percentage of those folks that is not immune. And then more broadly, as I said earlier, we know that the vaccine is extremely effective at preventing symptoms, but we don't know how effective it is at making someone immune from getting infected. So assume, even if you've been fully vaccinated, that there is a chance you could contract the infection. Odds are you're not going to get hospitalized or even feel sick, but you still should be following the mitigation strategies. Now, it may be next week, a month from now, the CDC says, yep, we've got enough data to say that, yes, you are immune, and we can change the guidance. But for right now, the guidance is still act like you're not immune, even if you've been fully vaccinated, and continue those mitigation strategies.
Why isn't there a good antibody test?
But that's a good question. Well, so there are 2 pieces to that. The first is the antibodies to this strain of coronavirus are very similar to antibodies to the many other strains of coronavirus that humans have. So the common cold is most of those viruses are coronaviruses. So it's hard to tell the difference. The other is we don't know what level of antibodies necessarily means you're immune. So particularly for vaccination, you may have a positive response, but we don't know if if it's 1 per 1,000, I'll just make up numbers, whether that, yes, you have antibodies and you're immune from infection, or you have to be at 5 per 1,000 or 10 per 1,000. We don't have those ranges yet. So there are some vaccines, there are some infections that test for immunity, and they have a threshold that says, well, if you're above this, you're immune. If you're below this, even if you have antibodies, you're not immune. We don't have that information yet. So unfortunately, there's no way to tell for sure that you're immune from the vaccine. Hopefully, we'll find, again, in maybe a week, maybe a month, that the CDC says that we've learned enough that if it's been 14 days after your last dose of vaccine, because it takes a good week or two after you've been vaccinated for the body fully to respond to it, up till 90 days after that last vaccine, that will assume you're immune. The CDC isn't there yet, but easily they may be there. Similar to when the CDC has said several months ago that if you have a known infection, we'll assume you're immune for the next 90 days from that infection. So as we learn more, it will make it easier for the scientists to actually say what vaccine does for you and whether you can feel comfortable if you've been fully vaccinated and say hypothetically you're going to a dinner party of other people who are fully vaccinated, that may be a safe interaction.
And so it would be the same answer if somebody just wants to know if they had COVID. You know, a couple months ago, they had some sinus thing, they didn't get tested, and now they regret it. But there's really no good test for that yet, right?
There's not a great test for knowing if what you had 3 months ago was COVID.
Right.
And if it's 2 weeks ago, you can get tested. The challenge is if with an antibody, with a PCR test. And the challenge is the PCR test can stay positive for a while. So that won't tell you when you were infected. And so the downside is if you do a PCR test to try to look for an infection a month ago, if it comes back positive, that could be a new infection or it could be leftover virus from a month ago.
Okay. Why is it now more difficult to get an appointment for the second dose? It says no appointments available.
So there are two reasons for that in general. The most common reason we're seeing that today is just the fact that we have to request to the CDC to set up clinics. And sometimes there's a delay in that. So if hypothetically someone went to get their first dose today or yesterday, and now they're looking 21 days out or 28 days out, the CDC just may not have processed our request for a second dose. So we ask folks, if you find that, just check again in another week. You're not going to go without your second dose. We're going to make sure of that. We always get shipments of Moderna and Pfizer. No one will miss out that window of up to 42 days to get their vaccine. But if you're on day 2 or 3 after your first dose and you can't find a second dose in VAMs to get vaccinated, just try again another week. If you're on day 10 after your first vaccine and you still don't see anything, something may be going wrong. Let us know. We'll schedule you in. But the first step is for you to just have a little patience. We're not, as far as I know, even with the snow days that we had to close and the delays in Moderna, anyone who let us know that they were having a problem getting in 42 days, we were able to get them in. And then the vast majority of people were able to do that on their own. There is another group of folks, though, that are seeing problems because originally in the VAM system, when we set up a clinic, it was visible to the whole world. So we had some folks coming in from outside Loudoun County to our clinics. We're now able to restrict that to Loudoun County residents. So now they're not able to find second dose clinics. So if, hypothetically, you were in the Arlington public school system and you said, oh, I can go out to Loudoun and get vaccinated, and you did that in January, and now you're looking for your second dose, you're not going to see a second dose clinic with us. So we have had some of those folks email us, and we've set them up because, again, regardless of whether they should have come to us or not to begin with, we don't want anyone going without their required second dose.
It affects us all in the end.
Yeah. And we do get, just to that point, we do get a specific allotment of second dose vaccines. So their dose has already been given to us, essentially. Even though, they came to us for a first dose, when they should have gone somewhere else. We're getting an extra second dose because of it.
Because they
And
got.
so we're already covered for their second dose.
Okay, great. So we're combining the next two questions because they're similar. If someone wants a specific vaccine or wants to refuse one for religious reasons, is there a way to find out what facilities will offer which vaccine once it ships to the county?
Yeah, so we don't offer choices between Pfizer and Moderna because they're so similar. Johnson & Johnson is a very different vaccine from Pfizer and Moderna, and so there are easily folks that will have a preference of taking Johnson & Johnson or not taking Johnson & Johnson. And we want to honor that. So right now, for example, on Saturday, we're going to be having a Johnson & Johnson only clinic. And so the only people we will be signing up for that are people who want to take the Johnson & Johnson vaccine. Going forward, when we do get more Johnson & Johnson, when people go into the VAM system to sign up, it'll be labeled either Johnson & Johnson or Moderna Pfizer. So what we ask folks is if you do have a preference, we think that you should take whichever one comes first, but if for whatever reason, it's important to you to have either Johnson & Johnson or Moderna Pfizer, then if we have Johnson & Johnson in stock, then that'll be labeled as such. Again, we just don't know when we'll get our next shipment of Johnson & Johnson. So if it's not something where they can't take Johnson & Johnson and it's time for their vaccine, if it's something where they really want to take Johnson & Johnson, but there is no clinic that we have scheduled, then you take whatever's available. Because again, we would hate for someone to get infected, have a bad outcome because they were hoping for their Johnson & Johnson vaccine that just never materialized. We just don't know what the delivery schedule for Johnson & Johnson will be. We do know that consistently we're getting Moderna and Pfizer.
Okay. Are there any plans to use a heterologous prime boost strategy for the vaccination program?
So if I understand that right, in terms of mixing the products, and if that's what they're asking, then no, I don't. That's not being recommended. What is possible is if hypothetically someone got Moderna or Pfizer as a first dose, and then we ran out of Moderna Pfizer, that the CDC does say that you can use Johnson & Johnson as your second dose. But right now, the recommendation is not to intentionally mix products.
Okay. Should women be concerned with getting mammograms after getting the shot? I heard that lymph nodes could be inflamed and cause concern when there should not be concern.
No, if you're due for your mammogram, get your mammogram. Don't put off any other procedure. Again, the only thing that potentially you put off is another vaccine. But tell your doctor, that if you're having a reaction to this vaccine or a different vaccine that may cause enlarged lymph nodes as a result, just let your doctor know, and they'll take that into consideration. But again, don't put off any medical procedures, and particularly we found that during the pandemic, many people put off routine health visits to their doctors. They're not busy now. They want the business. So if you're due for a periodic checkup, if you're due for a focused checkup for a specific medical issue, call your doctor. Don't put it off any longer.
So you're not concerned that it would inflame the lymph nodes?
And it's not concerned that you should put off a mammogram.
Okay.
Just let your doctor know if you get your vaccine, just let them know when you go for your mammogram.
Okay. This is another combination of questions. Speaking of mixing brands, if needed, do you think we will get the same brand of vaccine on the specific day we schedule our second dose? What about for boosters? Will we need to take the same brand of booster that we took for the initial vaccine?
Yes. So the recommendation is you take the same brand. Not that it wouldn't work, but there's just not been a study on it. So what we know is the studies show if you do Pfizer and then 21 days to 42 days later take another Pfizer, it's very effective. Odds are if your second dose after the first Pfizer is a Moderna, It's very likely going to be very effective, but there just hasn't been a study on it. So, as I said, each week we get Pfizer and Moderna doses. We make specific orders for second dose vaccines. They're the exact same as the first dose vaccine, but we order them separately to make sure that we have enough second doses to cover the people that need second doses that week. So we should always have enough Pfizer and Moderna for somebody to get the same product they got the first time and get it within that window of up to 42 days.
There's some more questions about how contagious you are after getting vaccinated. I know you've been over this a little bit, but maybe you can tell us again. If you are fully vaccinated, can you still spread the virus to others? And can those who are vaccinated still spread the virus? Should they continue to maintain the same bubble? Are hugs okay?
Yeah, so for right now, the answer is assume you can still be contagious. That easily may change as we learn more. But because that wasn't studied as an endpoint in the research, they just didn't have that information when these vaccines became public. They were looking at their study endpoints, whether folks got sick, not whether they got infected. We're finding that out now with the millions and millions of folks that have been vaccinated. And we'll see, and hopefully the CDC soon will come out with further guidance on the effectiveness in actually preventing you from getting infected. But I think, as I said earlier, very likely what we'll see is that both the Moderna and Pfizer are very effective at preventing an infection in addition to preventing you from getting sick.
Okay. I know we're almost out of time. We're going to try and send you a couple more. Is that okay?
Sure.
All right. Do you know of any masked person shopping in a supermarket? Do you know if any masked person shopping in a supermarket caught the coronavirus in that environment?
I don't know. And it would be very hard to know where folks got it. Because right in the beginning of the pandemic, before there was sustained person-to-person transmission throughout the county, it was easier to say, oh, this person very likely got it at this one building. But right now, other than outbreak situations, it's really hard to know where someone picked up the virus because so many folks have the infection and have no symptoms at all. It's a lot easier to say, oh, they went to a Super Bowl party and now 10 people are infected. Mm-hmm. It's a lot harder to say someone went to a Giant and then a week later tested positive. It must have been from that Giant because that person wouldn't have known if they came in contact with anyone who was infected. And easily, we wouldn't be able to trace it back to any one person.
There's been some talk about certain blood types being more susceptible to getting the virus in a serious way. What do you think about that?
It's very likely. The bodies are so much more complex than we think about on a daily basis. For the same reason that African Americans, for all the same risk factors, are much more likely to be seriously affected. There's so much to our genes that make us more or less susceptible to a virus and to being able to fight it off well. So not only for this, but in other situations, things have been associated with blood type. And what that causes, whether there's something else in the genetic makeup that's responsible both for blood type and for the ability to fight off virus, we don't know. But so we look at that as an association that certain blood types are more likely to have more serious complications, but it doesn't necessarily mean you could do anything about it, or that if you're at a specific blood type, you can take any fewer actions as a result. It's still, and very likely, at least for the next 6 months, keeping your distance, wearing your mask, getting vaccinated when it becomes available, and staying home when sick, which are so important. And the other piece is, as I said, we have all these added benefits. Every year, tens of thousands of Americans die of the flu. They didn't this year because of the mitigating steps that people took. So it's a horrible thing that we had over 500,000 Americans die of COVID, but because we took those mitigating steps, the different 20,000 folks did not die of the flu. Similarly, the spring tends to be a time when we have different types of viruses spread. Having those masks, keeping the distances should also help with that as well.
So some states around the country are loosening their restrictions. Are you concerned that will have an effect here?
Oh, easily it will. What we learned very early on is coronavirus spreads very quickly. And so what happens in one part of the United States will spread to other parts of the state. The other piece that's concerning is the variants of the virus that are emerging, or the mutations. And the more the virus is spread, the more likely you have variants. Because coronavirus is a virus that likes to change. And the more opportunities you give it to change, the more likely it will. And the more it changes, the more likely it will change to a form that's worse. So some of the times it changes to a form that's better, and you just never see that again. But when it changes to a form that either causes more serious infection because it goes down into the lungs further, or is easier to spread because it takes fewer particles, or it's more likely to be in the nose, then it makes all of us more at risk. And now, particularly with the vaccine out, potentially you get a variant that is less susceptible to the vaccine. And that puts all of us at risk. So yeah, it really is unfortunate. We know folks are frustrated. Yeah, we know, people want their high school football season. They want to go back to normalcy. But yeah, it's really early for that. We're getting 60 cases a day of coronavirus, which sounds like not much compared to 300 a day. But when we were getting 60 cases a day in November, that was a lot. When we were getting 30 cases in August, September, that was concerning. So we're still at a high rate. And 250 Loudoun residents have died so far from coronavirus. This is the time where we really can take those steps and say, we've got that light at the end of the tunnel. Every day is 1,000, 2,000 more Loudoun residents that are vaccinated. Let's just keep this up a bit longer.
Yeah. So on that note, what conditions will have to be met before we can return to normal life without social distancing and mask wearing in public?
Yeah. So I think the big thing will be when we have some days with no new cases, when there's not continued community spread. That's where we were back in the March timeframe, early March. And you could just say, let's focus on vaccination. Let's focus on where you get a case and then cocoon that person so they're not spreading it. But we're not there yet. And so, again, every day that folks are having a St. Patrick's Day party or coming up a big Easter celebration are going to be days where likely folks are getting infected unnecessarily.
Yeah. Okay, so we're out of time for more questions. Thank you so much for giving us your time tonight and answering these questions. And I think on behalf of everybody, thank you so much for all you're doing to keep us safe.
Well, thank you. And again, thank you for inviting me. And please, any questions folks have, email us at health@loudoun.gov, call us 703-737-8300. And particularly, if you could be getting vaccinated now but are hesitant about it, we want to give you the best information. And for when the time comes for the general population, please take advantage of the vaccine.
Thank you so much. And we've put that information into the chat feature, so please do take down that information so you have it if you have any questions.
Thank you.
Bye-bye now. Thank you all for joining us tonight.